Hi, my name is Lester George, and today my friends and I will talk about body composition. And first, what is body composition? Body composition is a method of breaking down the body into its core components such as fat, protein, minerals, and body water. Then, body composition analysis can accurately show changes in fat mass, muscle mass, and body fat percentage. Next is, does body composition is important? For me, is yes, because by learning body composition, we can know what is healthy and what is not healthy, especially when it comes to fat. And when we learn about the body composition, we can understanding and when we can different between thinness, leanness, overweight, and obesity. These are the types of body composition tests. First is waist circumference. Next is body mass index, or call it BMI, and the third is skin fold calipers. This is the waist circumference objective, procedure, and equipment needed. The objective is to test the hypothesis that a single measurement waist circumference might be used to identify people at health risk both from being overweight and from having a central fat distribution. And what is unique is only one thing, that is measuring them. And this is the procedures that I will explain it to my video. And this is me performing the waist circumference.
First, you need to stand up straight and find top of your hip bone and bottom of your rib cage. And then find the midway point between the two, then mark the area to measure. Once you mark the area, you need bring the tape measure all the way around your body and then measure your waist circumference. Make sure it's not too tight and don't hold your breath while you measure. And then check the number on the tape measure right after you exhale.
And this is the waist circumference chart. And for your best health, your waist should be less than 40 inches around for men and less than 35 inches for women.
Hello guys, my name is Sibamiu. I'm from the SR243. Today I want to show you video about the BMI. Uh, we need to know what is BMI. BMI is body mass index, is a value derived from the mass and height of a person. The BMI is defined as the body mass divided by the square of the body height and is expressed in unit of kg and meter, resulting from mass in kilogram and height in the meter. Besides that, the objectives of BMI also we can see from measurement can give an idea about whether a person has the correct weight for their height. And this is a classification of the body mass index. We can see from the underweight have 18 and follow the normal have 18 until 24 and overweight have 25 until 29 and obesity 30 until 34. Firstly, my equipment is I use the tape and white scalers to take the result for my BMI. With that, I would like to give a few examples of a video with BMI taking again ourselves. First, by taking data to measure Y by using the Y scales that have been provided. Next, measure the height with the upright step to take the height by using the measuring tape. The last is this is my result of the BMI with Y and height measurement with BMI. So for my BMI, my BMI is category normal in 23.8.
Hi, I'm Siti Daya. Okay, let's move on to the new slide. The next topic is skin fold calipers. Skin fold calipers to estimate how much fat is on the body. The main purpose of skin fold measurement is to estimate general fatness and the distribution of subcutaneous adipose tissue. Fat is pinched between a two-prong caliper on designated body sites such as tricep, bicep, abdomen, iliac crease just below the scapula, the thigh, and the chest. Equipment needed is definitely a body fat caliper. Procedure for skin fold measurement. You need to firmly grasp a fold of your client's skin between your thumb and your index finger and lift this up. The skin fold should include the thickness of the skin and one of the subcutaneous fat, but no muscle of fascia. Place the contact surface of the calipers at the 90-degree angle to the skin fold, approximately 1 cm before the fingers. Slightly release the pressure between the fingers, but remain holding the skin fold so that a greater pressure is applied by the caliper. Release the handle of the caliper and direct the needle to the nearest 0.1 mm approximately 4 seconds after the pressure is released. Next slide about 9 anatomical sites that are most commonly used in the assessment of skin fold thickness. 1. Chest or pectoral skin fold. For men, get a diagonal fold halfway between the armpit on the nipple. In women, a diagonal fold 1/3 of the way from the armpit to the nipple. Number 2. Mid-axillary. A vertical fold on the mid-axillary line which runs directly down from the center of the armpit. Number 3. Supra-iliac or flank. A diagonal fold just about the front forward protrusion of the hip bone, just above the iliac crease at the mid-axillary line. Number 4. Abdominal. A horizontal fold about 3 cm to the side of the midpoint of the umbilicus and 1 cm below it. Number 5. Quadricep or mid-thigh. A vertical fold midway between the knee and top of the thigh, between the inguinal crease and the proximal border of the patella. Number 6. Tricep. A vertical fold midway between the acromion process and the olecranon process, or elbow. Number 7. Bicep. A vertical pinch mid-bicep at the same level the tricep skin fold was taken. Number 8. Subscapular. A diagonal fold just below the inferior angle of the scapula. And the last one, medial calf. The foot is placed flat on the elevated surface with the knee flexed at a 90-degree angle, a vertical fold taken at the widest point of the calf and the medial inner aspect of the calf. Okay, now let's move the norm of body fat percentage. Adult body fat percentage for women. Since a BMI calculation is based solely on your height and weight, being female or male doesn't factor in how that number is calculated. That said, there are differences between men and women when it comes to body fat percentage range. Body fat percentage for women fall under a few different categories. Some chart will divide the percentage by categories such as athletes and acceptable range, while others divide the range by age. So how about men? In general, men have a low body fat that lean tissue ratio than women, which explains that differences in the range. Reproduction plays a role in the higher body fat percentage for women. Please note, all measurements should be carried out on the right side of your body. It is supposed to keep your skin dry and without applying any skincare product before measurement. Last but not least, it is highly recommended to measure before doing exercise because it will be affect the accuracy by moderating the hydration state of different body tissues. So now let's see the video how to perform the skin fold with calipers.
All measurements should be made on the right side of the body with the subject standing upright for the 7-site skin fold test. Calipers should be placed directly on the skin surface 1 cm away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Pin should be maintained while reading the caliper. Wait 1 to 2 seconds, no longer, before reading caliper. Take duplicate measurements at each site and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through the measurement sites or allow time to skin to regain normal texture and thickness. The first site is the triceps. Vertical fold on the posterior midline of the upper arm halfway between the acromion and olecranon processes, with the arm held freely on the side of the body. The next site is the subscapular, which is a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. Next is the chest pectoral. It is a diagonal fold, 1/2 of the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The next fold is a mid-axillary. It's a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. Next is an abdominal fold. It is vertical, 2 centimeters to the right side of the umbilicus. The sixth fold is the suprailiac. It is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The final site is the thigh, which is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. After assessing the test, add up the sites and find the mean value. This mean value can be put into the body density equations. There's one for men and one for women. From the body density then can be put into the equations for body fat percentage, which can be conducted through the Brozek or the Seery equations.